Hello everyone. Today I would like to welcome everyone for this webinar today. And I would like to invite our guest for the day today, Dr. K. Paulson sir. And he is Joint Secretary of the IAP Karnataka, and he's founder of FIMT, that is Federation of Indian Manual Therapists. And it has the mission to provide the advanced training in the specialty area of the orthopedic manual therapy for the Physiotherapist of India. And he is head of the department of the Padma Shri Physiotherapy College. So I would like to hand over to you. Please say a few words.
Thank you, Dr. Richa, and welcome, Dr. Kaviarasu. So, yeah, good evening, all. It's a great pleasure for me to be along with you on this IAPWC, Karnataka State Branch webinar series, and it is a wonderful, organization doing a lot of work, doing particularly not only on this COVID time, they have been doing, regular conferences and workshops apart from this COVID time also. And I appreciate that for their wonderful attribution towards the, upliftment of the Society of Physiotherapy. And this topic, what Dr. Kaviarasu is going to talk, the role of critical thinking in physiotherapy is very close to my heart because it's more about clinical reasoning. So when I say clinical reasoning, I would always appreciate that six-man army, why, where, when, and who, and what, and what, all these questions. It's a more of a questioning things. I really think this platform will help people to get better with the cognition and the metacognition and the knowledge base, which is the basic thing, because it's not only to know good or bad, what is good or bad for practice, but questioning ourselves what we are doing. So that can be attained only through this, critical thinking. And without critical thinking, there is no point in learning any technique. So whether it is a manual therapy or or dry needling or whatever it may be, we need to have a critical thinking. We need to have a clinical reasoning. So I really appreciate IAPWC for taking charge of doing this kind of webinar, and which will definitely help all the physiotherapists and the students and every practitioners to get better. Thank you very much, all of you, for going to enjoy this session, and thank you IAPWC for inviting me for this occasion. Thank you very much.
Thank you so much, sir, for your precious time and your guidance and blessings for us, and helping us from last 20 years almost in Bangalore. Thank you, sir. Thank you so much. Okay. I would like to tell all the participants to please mute your audio and the video. Please, you can off mode. And yeah, now I'd like to invite, today's topic is our critical thinking in the physiotherapy. And I would like to invite Dr. Kaviarasu Mahalingam. And he has 13 years of experience in the clinical, all the perspective in the physiotherapy, including the corporate in the multi-specialty hospital clinical. And meanwhile, he has experience in 9 years of teaching almost in a clinical aspect and the practical aspect. So these are the thing for a student. This is going to be really unique topic as we hardly come across while studying whole bachelor's in physiotherapy and all. So critical thinking about this thing. So this will be really helpful for all the students, and you can come up with the questions and all at the end of the sessions. So now I'd like to hand over to Dr. Kaviarasu Mahalingam to start yourself. Thanks.
Thank you, Dr. Richa, for this wonderful opportunity. I would like to thank IAP and IAP Women's Wing for giving this wonderful opportunity to share my knowledge. So it's a great, it's going to be a great experience for me as well as for the team, I hope. Am I audible?
Yes.
Yeah, okay. And I would like to thank Dr. Paulson for giving a great introduction on the clinical thinking. It's a kind of summary. Thank you, Doctor. And I would like to thank Dr. Sumita for giving a wonderful opportunity. And I would like to thank Dr. Indumati and the team for giving a wonderful opportunity. Okay, so without further delay, let's get into today's topic. Yes, it's going to be really very interesting. The role of critical thinking in Yes, myself, Kaviarasu Mahalingam. I have from India, and I'm experienced around 14 years, and I have completed my master's from the UK. I've done my advancing physiotherapy practice. Really, where I got my, the insight on critical thinking is from there. That's why I wanted to create a fire between our community that we have to critically think. Whatever we do, we need to think. I'm currently working as a lecturer cum specialist physiotherapy in School of Physiotherapy in Ames University. The campus which is in the background is the place where I'm working now. Yeah. So what are we going to discuss today? It's all about how to think, how to think. That's all. It's very simple. Think, how to think. So what is thinking and why it is so important? I think some noise is there. Disturbing. I think we can mute it.
So just 1 second, sir.
Hello, everyone.
I'll just mute.
Yeah.
Yes, sir.
Okay. Yeah. Thank you, ma'am. Yeah. So what is thinking and why it is so important? Thinking, everybody knows that it's a cognitive activity. So the brain consciously involves during the thinking process. So we will be using the thinking in order to understand the world around us and decide how to respond to it. If you take in a day, most of the time we would be spending by thinking one or the other things. It may be for doing household activities or any professional tasks, going here and there. Okay, so kind of routine. Everything requires thinking. The world is quite demanding, and presently the situation is pandemic and it locked every one of us inside the house. We have to think a lot to come out of it. The scientists are working on finding the medicine for that, and we are trying to protect ourselves staying in the home, and few physios are really working very hard in the cardiorespiratory units and front lines and so on. We have to think a lot. Do you think this is critical thinking? Absolutely not. So these are the thinking which we do for our daily routine, like going to work or doing a work in the system, going bed, showering, so those kind of things. These are daily routines. For this, yes, we do need thinking, but this basic thinking is different from the critical thinking. For these activities, we mainly need the low level of thinking skills such as remembering, understanding, and applying. So this work well for routine tasks or problems which are well defined with clear outcomes. Okay. I wanted to show this picture to you. So most of you might have seen this in the YouTube or any social media. This is a 7-second riddle. So this one is asking for who is innocent. Okay. If anyone is asked, okay, what they will think in 7 seconds, they have to make the decision, right? So they will be thinking that elderly woman, obviously she might be innocent because physically she is weak. And then they might be thinking the pregnant woman because she is physically weak. At the same time, she is emotionally upset as well. Similarly, the elderly person may be. The other person who looks a bit arrogant near the wall, she is kind of posing like beating on the wall. People will immediately come to a conclusion that she is not innocent. The answer, whatever it may be. Okay, this is intuition. This is intuition. Okay, Intuition, it is not critical thinking. There are more chances for us to make wide range of errors. Why? Because we are making a quick impression, a quick fast impression, because we might be having unsubstantiated views and sometimes, popular opinions. In your home, people might be telling that elderly, always you have to help them. Who knows? They may be doing something wrong. Sorry if I'm offended. Okay, so we have to make a decision after scrutinizing the concepts, right? Here, in this quick impression using intuition, decisions are made without scrutiny. There will be insufficient information and lack of further deliberation. So that's the reason it is taking you to a false information and a false decision making. So, however, intuition is one of the important skills developed through experience. Usually always experts will make a decision using intuition, but I would not recommend in the early stage to use intuition as one of your tool or one of the strategies for thinking critically. Well, who are experts? Yes, everybody are coming across the term, he is expert in this, that. Well, a person with extensive knowledge and the skill. But these attributes are elusive and difficult to measure. It's a kind of tacit concept. It's really very difficult to measure. So if you look, Jensen and Grievance in 1999, they proposed that expertise in physiotherapists, it's some combination of multi-dimensional knowledge, clinical reasoning skills, and skilled movement and virtue. So everybody should be an expertise, but we have to train ourselves to become an expertise. But strictly for novice, it's very difficult. So each of these core dimensions exist, but they do not appear to be well integrated. Okay, sometimes students who are doing a good performance, they feel that they are well versed, but actually there will be a practical difficulty in integrating the informations. So these are the things we are going to look for today. And before that, let's do a warm up for the brain. It's a brief scenario. A patient reports mid-thoracic pain consistently provoked after sitting to eat lunch. Okay, this is a very brief scenario. Well, if you ask someone, a physiotherapy student, for instance, a patient reports mid-thoracic pain. Okay, so there is a pain in the mid-thoracic region provoked after sitting to eat lunch. So we can think that patient is sitting in fully slouched position, maybe during sitting. So they may interpret nociception associated with slouched sitting. But if you ask a person who is expert or who applies the concept of critical thinking, he'll be thinking in a different way, an alternative thinking, which is the nociception may be associated with gallbladder, secondary to eating fatty food. Okay, just this is to ignite how the critical thinking looks like. Well, so if you look at our brain, okay, our brain works fast and slow. Usually our subconscious brain works faster, and conscious brain works a bit slower. So our subconscious brain is something like automatic, effortless. It gives a kind of fast impression and intuitions. As I was telling earlier, it's a type of tacit pattern of recognition. Sometimes if you ask a person who is riding on a bicycle, okay, how you are turning the edge, if you ask him, he will surely have no words to explain how he is turning, because it's a skill that he learned by himself, which he can't explain. So you need experience, okay, through guidance. Yes, then you can learn. Well, the slow thinking. The slow thinking is a kind of analytical deliberations. It requires more attention, time, and effort. This is very important. We have to spend more time in doing critical thinking. And at the same time, we have to take a lot of effort. So I'm going to tell about the strategies during the critical thinking. So it gives you the ideas how to do it. Well, so tacit is something like intuitive knowledge, know-how, so which is rooted in context, but really you have no words to explain. But explicit is codified knowledge found in the documents databases. For example, when you are looking into a patient case sheet, probably, okay, so you'll be writing or you will be documenting what kind of assessments you had taken and how the prognosis was, and how you modified the treatment approach or the assessment pattern. So all these comes in the explicit way. So through that we can learn. Well, greater the coherence of fast thinking impressions, the more likely we jump into conclusions without further analysis. Yes, unfortunately, we humans find and accept coherence on the basis of limited information. What you see is all there is. This is assumption. Honestly, I think you can talk to yourself saying that, yes, I do, assume, right? Most of the time, the assumption is there. What you see is all there is. Well, all the fast thinking is a source of many errors. Ironically, it is the source of many that we do right. So my main point is not to state that initial impression and fast thinking is wrong, right? Our skills should be built through quality practice and to be aware of pitfalls and common errors of bias. Quality practice. What should we do to deliver a quality practice? Yes, critically think. Think to think. That is critical thinking. In a succinct sentence. Critical thinking is a kind of systematic logical process of deliberation. So why critical thinking is important for a physiotherapist? Well, so before that, we need to see an updated definition that explains who physiotherapists are. Physiotherapists are autonomous health professionals who are responsible for developing, maintaining, or restoring motor function and movement throughout the lifespan using evidence-based practice. Here, you have to pay attention on two terminologies. One is autonomous practitioner, another one is evidence-based practice. Nowadays, Western country, the scenario is different, and in our country, India, and presently where I'm working in Malaysia, it is different. So in Malaysia, mostly you have to see the patients through referral. But in the UK or in India, the patients can come directly to you. So when you are an autonomous practitioner, you have a lot of responsibilities, right? So you have to make your own clinical decisions, either to continue within the scope of your treatment or to refer to the concerned specialist. So autonomous is something you have full responsibility on you. If anything good or bad, you are responsible. So if we wanted to provide a quality care, we have to be very responsible. For that, we have to critically think. So critically thinking is the ability of a clinician to analyze the complex data and the situations in order to implement the appropriate strategies, right? So we have to analyze all the data which is available and the data which is not given, right? We have to look for it automatically, or we have to volunteer to ask for those informations. And we can expect the unexpected situations as well. So then we have to implement the appropriate strategies or the actions and is necessary for effective problem solving and making a decision in our clinical area. Well, this is the clinical thinking. So clinical thinking is having a process, right? Why the process is needed? Mainly, this process helps us to appraise the information for its accuracy, completeness, and the relevance to facilitate the understanding and identification of solution. So we have to gather, first of all, we have to identify the problem, what it is, whether the problem is in the soft tissue, if soft tissue, what are the soft tissues? Or if the problem is any internal organs. So we should be able to identify the problem. After that, we have to determine the best solution. So we have to determine whether we have to treat by ourselves or to refer. When it is coming to our own solution within our scope, then we have to choose the most appropriate, effective method. Then we have to implement the solution. So while implementing, while choosing, while determining, you might be having a lot of problems, unexpected problems. So you have to overcome that. For that, you have to reflect, reflecting on whether or not the chosen solution is effective. So this is the process. Identify the problem, determine the best solution, choosing the most effective method and implement it, and finally reflect it whether it is effective or not. Well, what is the characteristic of critical thinking? So what are the components? What will be there in the critical thinking? Yes, here I have shown a chain showing 5 components of it: rational, curious, open-minded, flexible, and focused. The term itself says you very clearly what it is. Well, rational. It's nothing but you have to be logic. Okay. Whatever the conditions you are looking, please look at it logically. Don't look at, kind of theoretically, don't look at it. Look at the condition logically. Seek out the reasons. Clarify to ensure you understand and comprehend the information. So I would strongly recommend to avoid gut reactions. Gut reaction is something like, kind of instantaneous reaction without looking for the pitfalls. Well, so you have to be curious, ask a lot of questions related to that, and listen to the different perspectives and opinions. But you have to be open-minded. You should not make any judgment, right? You should not be prejudiced. You have to listen to the different perspectives and then seek for the evidence. This is the evidence-based practice. And synthesize to formulate your opinion. Open-minded, as I told you, you have to challenge your own assumptions and personal biases. Do not dismiss ideas which may be unpopular or unusual. Yes, now during this pandemic situation, people are giving a lot of opinions. Simply, we can't just avoid it. We have to critically think about it, and whether logically it's going to work or not, we have to test. That's the reason we are locked up for so many days. We can't immediately take an action in the first impression or a thing which was told by someone. Evaluate how your emotions and assumptions are influencing you. And you have to be very flexible. So if you come to a conclusion, you should be able to change that opinion if you get a better idea. So do something differently and learn and apply always something new. Okay. Whatever you do, please be focused. So even while you're thinking, you have to be very focused. So if you miss some information, obviously you are not going to make an effective decision. So you have to be very focused. Analyze and break down the complex problems, decisions and tasks to make them manageable. So you have to take a decision that should be manageable, and you have to be strict enough. You have to remain clear about the end goal, right? So these are the characteristics. Yes, I do have some strategies for you to think critically. So these are the main strategies what we use today to think critically. First and foremost thing is clinical reasoning. As Dr. Paulson was telling, clinical reasoning is all about critical thinking. Then we have to think about the pattern recognition, repetitive mental representation, and finally, yes, intuition. Intuition is also one of the strategies, but as I told earlier, it is not suitable for a novice. Novice is someone who is studying physiotherapy final year or recently graduated physiotherapists who are looking into the patients. Well, so clinical reasoning. In clinical practice, critical thinking can be referred to as clinical reasoning. Yes. So it's a reflective process of inquiry and analysis in collaboration with the patient. So I think most of you might have heard about the biopsychosocial model, right? So this is a very effective model that is widely used in Western countries. I'm afraid that in India, how it is, I hope like nowadays it should be because we have to implement all these strategies and models. It really works very well. So biopsychosocial model is something we have to give importance equally for the body, right? What the body is saying, we have to listen. And then what the patient's mind, what the patient is saying, and what the patient's kith and kin are worried about, and what is the leisure activities, the social activities, their hobbies, their job, right? So we have to think all these things and we have to take a decision. So clinical reasoning would be very helpful in reflecting these processes. Okay, so aims to understand the patient's context and the clinical problem to promote the evidence-based practice. The clinical reasoning skill differs from novice and expert physiotherapists. I'm very sure about it, because novice focus only the diagnosis, whereas the expert focus on every aspect intuitively, right? So as I told, yeah, intuition will be working when you are expert effectively, right? So there are several reasoning strategies such as diagnostic reasoning, narrative reasoning, reasoning about the procedure, interactive reasoning, collaborative reasoning, reasoning about teaching, predictive reasoning, and ethical reasoning. So diagnostic reasoning. So diagnostic reasoning is something that you should be able to reason the diagnosis with the functional limitations and physical movements and impairments. Something like what is the pain type, right? And what could be the tissue pathology, potential contributing factors. So we have to look into all these aspects and reason out the diagnosis. We should not simply focus, okay, this is the diagnosis, I will be treating only that. The root cause may be different, right? So narrative reasoning. So make the patient to talk a lot, right? So you have to interview the patient to ask about the patient, what kind of pain he's having, illness, disability experiences, and try to gather the information and try to integrate it while you are taking decision. Reasoning about the procedure. So yes, you have to select and implement and progress the treatment technique, what you are using. So the best idea would be use the evidence-based practice, look into the recent evidences using databases, and you can look for the CPD programs, what you really wanted to do and your area of interest. That would help to reason about the procedures, whether it's an effective or not effective. So if you come across some new techniques, yes, you have to be open to accept that. So interactive reasoning, so purpose of establishing the clinician-patient rapport. So try always to involve the patient in the treatment. So best example I would say is try to talk a lot to the patient. So ask how about the treatment and what was the pitfalls? Is that okay? Whether the patient is happy about it? What's their personal opinions, right? So all these things you have to ask about it, but you have to be very careful while you're integrating the informations, because there might be some informations which may not be valid. So you should be able to, deduct it accordingly. Collaborative reasoning, shared decision making between patient and the therapist while you are doing assessment, goal setting, priorities, implementation, and its progression. So reasoning about teaching, well, so you have to plan, execute, and evaluate. For example, if a patient is having pain, so you have to ask, how are you coping up, right? And how you are improving your physical capacity. And if they have any false beliefs, it's our responsibility to empower them by teaching using a proper, explicit way. Predictive reasoning, right? So judgment regarding the effect of specific interventions and the overall prognosis. So you should be able to predict, and you should be able to reason your prediction, right? And then ethical reasoning. Ethical reasoning, yes, we have to consider the ethics. We have to give importance for patient to make a decision on their health and its goals and treatments. Yeah, this kind of ethical reasoning is a bit different from the Western country to our India. So according to the national policies, we have to stick on to the ethical reasoning. Pattern recognition. Yes, the pattern recognition is also another main important thing. If you look into this flow chart, okay, so how a hypothesis generated, okay, so the red line shows the novice, and the black arrow shows expert, how they approach the treatment. Okay, so the main difference is expert will come to a conclusion after evaluating the hypothesis, right? So once after they get the cue acquisition, they go for hypothesis generation, and from that they will evaluate the hypothesis, right? And then proceed with the treatment. But on the other hand, novice, sometimes just by getting the cue evaluations, obviously they will go for the treatment, which is not an advisable pattern of recognition to proceed with, right? Repetitive hypothesizing. So repetitive hypothesizing is something used to test the diagnostic reasoning, right? So by gathering the information to confirm or eliminate a hypothesis, like a diagnosis is made, right? You have to do a repetitive hypothesis. Okay, the problem could be this. So I'm coming to a conclusion for this. No, this could be the reason. So like that, you can work on a lot. Okay. So mental representation or mental imagery is another strategy, which is mainly, used to do what you imagine is what the intended outcome is. Yes, it is also an important technique or strategy that you will be using for doing a mental imagery, right? So that is helping really to make a clinical decision. So reflective practice. So this is the one I was talking about, and I would like to, enhance the information on it. Mainly, it involves critical thinking with the ability to self-monitor. Okay, so we have to be monitoring ourselves and be self-directive and professionally autonomous. So this is what something about metacognition. So your self-awareness. Right? So when the self-awareness comes, right? So when you are reflecting your practice, so you might be treated a patient with, and you might have observed a great prognosis, right? So you have to reflect it, where the pitfalls, if it is a negative reflection, right? And where and how the things worked well, what could be the reasons? It could be the positive side. So always be aware of thoughts and the feelings, your intuition, and critically analyze the situation. So develop a new right? Sometimes, like you will be having a negative biases. If acknowledged and understood, they may less likely to interfere with the behavior and interaction with others, right? So we have to work on that. Okay, so here in this group, I think we may be having the preceptors who are monitoring the students or the novice physiotherapists in the bedside teaching, and as well as mentors will be available, I guess. So there are some tips for you to train the critical thinking. So first of all, you should be receptive. You should agree the suggestions and the ideas given by the mentees, right? So you have to support an environment that encourages the critical thinking. So allow the novice to make, to think and reflect. Please do not intervene. Okay, that will affect the process of critical thinking. So listen first. Do not provide any answers quickly or solve the problem. Don't rush yourself. Ask for clarifications, how that thought process was. Ask about the relevance of the thoughts to the current situation. So ask the facts that he or she has confirmed before sharing the knowledge. Time plays the major role. As I was telling earlier, we have to spend a lot of time on making decisions. Allow time for discussions. So review the situation from the learner's perspective, and we have to assess the communication style. And yes, we have to ask the learner to interpret what he or she knows about the patient and the situation. And ask them to evaluate the stress level, right? Allow time for the discussion, and try to assess the communication style. If you find any problems in these things, please provide mentoring, a regular mentoring, and then we have to monitor and then supervise. That really helps improving the critical thinking, right? Novice, you also have certain tips for thinking critically. Okay, so when you are doing a clinical reasoning, always screen for the additional symptoms not spontaneously volunteered. Okay, sometimes the patient may not say. We have to take an initiative to ask about, for example, if the patient complains of a knee pain, there could be some vascular causes, neuropathic causes, psychological causes, or musculoskeletal problems. So many aspects are there. We have to screen thoroughly, right? Find the root cause. Screen for the additional activity and the participation restrictions, which is not volunteered as well. And screen for the psychological factors and their relationship. Many times, yes, pain is perceived due to the psychological aspects. Screening for the general health comorbidities. During the the starting of the session, I was telling about there could be a different reason for thinking or interpreting. Something like a patient who complains the back pain could have a link with the internal organs, right? So try to reflect your practice and try follow the biopsychosocial model in your practice. Be an evidence-based practitioner that helps you to think critically and use the metacognitive skills. That's really self-awareness. So something like coming out from yourself and looking at your performance, whether you're doing it good, what are the good aspects, what are the bad aspects. So if you do good things, why, how? Learn that. If it is bad, again, do the same thing. Yes, we do have barriers for the critical thinking. Time. So we all might be busy with something. So this is a 1 hour session. I'm just dragging the session, I know that, but still time is a barrier for thinking critically. The situational stress. Yes, we are locked in the home, right? We are stressed. We couldn't go. We couldn't meet our friends. Some of them really enjoys doing work, so they couldn't do it, right? So yes, improper planning. So we have to plan it well. A closed mind. As I told you earlier, we have to keep our mind open to accept the criticism, to accept the opinion, but we have to critically think it's right or wrong, right? So we have to focus ourselves, and you should all of these can negatively affect the ability to promote critical thinking and results in a mentoring experience failure, right? So stages of critical thinking, we have mainly 5 stages, which is unreflective thinker, beginning critical thinker, practicing critical thinker, advanced critical thinker, and accomplished critical thinker. You yourself can able to relate which stage are you. So after relating, so you can work to progress to be the accomplished critical thinker. I'm sure you guys are going to be the accomplished, right? So I'm trying to ignite the interest. I'm just introducing what critical thinking is. This 1-hour session is, I'm sure it's not going to be sufficient at all. This is to create the interest in you, right? So self-learning is a very important thing to do it, right? So if you think if you compare an unreflective and an accomplished critical thinker, you can see very drastic difference. An unreflective thinker will be inflexible. He will be standing in his view if it is right or wrong. He won't think critically. But an advanced, an accomplished thinker will have an advanced thinking capacity. So unreflexive would be having fixed beliefs, and yes, accomplished will be having open-minded, right? So always we have to acknowledge the own assumptions and bias. So if we are not having a broad-minded thinking, if we lack of insight, then we would be tagged as unreflective. Okay, so unreflective practitioner would be unable to adapt to the new knowledge, right? Always we have to welcome the uncertainty, and we have to create the problem solving strategies and all, right? So, well, begin your journey as a critical thinker. This is my advice. Okay, so before that, I wanted to share quickly a scenario to ignite, your idea how to look for the clinical reasoning. Well, so here a small case scenario to discuss how to do the clinical reasoning. Well, a 40-year-old Karina, she's a hill runner, presented to you with a previous history of unilateral knee pain after intensive running, so which had become bilateral by the time of your first consultation. She also reported a prior episode of low back pain, and she still had some intermittent back pain at presentation. So this is the scenario. And what were your early thoughts about the mechanism involved in these symptomatic presentation, right? Well, so let me quickly finish it off in another 5 minutes to show how the critical thinking is. Okay. Well, so your reasoning should be something like this. Earlier, she had pain unilaterally. Okay, it could be either increased frequency of her running. She might be running, the frequency would have been increased with not giving enough time for the recovery. And she may increase her intensity of running on the steeper surface. Still, she is a hill runner. Okay, therefore, she might have breached the threshold of what her knee could cope up with. So because of that, quadriceps muscle would go for fatigue, and it may contract poorly during the eccentric contraction. So her inner range of quadriceps control was likely compromised, so she started hyperextending her knee. Due to that hyperextension of the knee would result in the inflammation of fat pad. So inflamed infrapatellar fat pad is highly innervated, so it would inhibit the quadriceps. So demanding through the joint increased during normal walking and running. So she might have started using the other knee by offloading the affected one. This could cause overloading to the unaffected knee and started showing the symptoms, right? So when a patient has bilateral knee pain, she will be reluctant to do a knee bending activity while she is trying to take something from the ground, maybe, right? So this may cause inflammation to the tissues and cause the reflexive multifidus activity. So which will, like when the quadriceps is weak, the patient may compensate by using hamstring and the calf muscle to stabilize the knee. Then the tight hamstrings will have an impact on the low back. So patients with low back pain often have the weakness of gluteus muscle group. This will affect the gait and the loading through the joints. Unless these muscle imbalance are corrected, she will be continuing to have knee and the low back pain. This is a kind of quick reasoning I had given for that scenario. Okay, so try to work slowly. So try to think in detail, step by step. Okay, start to be a critical thinker from today, right? So that's all for today. Thank you for your time. And if you have any questions, please.
Thank you so much, Dr. Kaviarasu, for your this critical thinking topic. And this is one of my favorite topic too. And you have really narrated well to how you can execute in the clinical practice, and each and everyone can pick up, and stage by stage you have portrayed strategies also too, which is very important. Knowing something we need, but if we cannot strategize the same thing, that is difficult for the thing. So almost you have captured all the questions actually. So, but still the major challenge what I have experienced as even same way clinical practice now. So as you mentioned about the time and their emotional imbalance, everything. So as you told, critical thinking about the practitioners, fine. But same time, what I realize, the critical thinking of the patients also matters. Exactly. And that's the first session, like first visit for the patient, new patient is like totally new, we both are. And then how we can, implement their sub strategy, how we can figure it out over there, or something which can be helpful in the first visit of the patient to analyze the patient's critical thinking about us, perspective.
Yes, well, so yes, we have to, make them to narrate whatever they feel. We have to spend some time discussing with them. We have to dedicate, say example, some 30 minutes or something to discuss about what they actually feel and what they really want. And we have to show the importance that the patient is respected, their values are respected. So once if we respect the patient's values, and if we do the modifications in the treatment procedures, then it would be really easy to address the problem, I guess. As you asked in the first visit, yes, if we pay a clear attention and ask them to talk, right? So really it works.
But same time, sometimes they go non-stop. Okay, 1 hour is also not enough. Second thing, their emotional imbalance also matters. So what do you suggest in the critical thinking, as you mentioned, strategy is wide, but don't you think if the therapist or the practice nurse, they read some books, accept their syllabus, which will help in their creating their critical thinking? As you told, beginners is difficult for directly when they come to the floor, and they cannot, take as a trial error. Okay,
that's true. That's true.
They are beginners, right? But how they can help themselves while they are doing their bachelor's or master's while studying, accept the classroom study, what they can help themselves.
Exactly.
So material is available on the online, everything, and also if you can help them to figure it out how they can come.
Exactly. So I would strongly recommend, in our education system, I think if we implement,
I wanted to ask that.
if we implement that kind of critical thinking, really it helps our student to have an insight, and they will be really learned how to do the critical thinking. For example, as I was telling about certain tips to the mentors and the preceptors, so we have to make sure that we are applying these techniques, and we have to we have to make the novice physiotherapist to clarify their doubts. We have to allow them, because most of the time, yes, even I was a student, I know that how difficult it was and how different it was before and now. Yes, now the critical thinking is really encouraged, and we have to implement that in our educational system. That will really help the students.
Yeah.
Yeah.
Yeah. So I would ask you again, like, if you can help some book to help themselves. Is any particular books except the syllabus? Students.
Hicks and Jones. It's really a very good book, and it's unbeatable actually. It's published in 2008, but still it is valid. And being an evidence-based practitioner, so I would recommend them to go through the database to look for the recent evidences. So, like the ideas which was given by Hicks and Jones in 2008 will be a bit kind of
back to 2020,
back. So we may update our knowledge using, the kind of critical review, right? So we have to review the articles, and we have to find the quality of it. For example, like we can go through the, Cochrane review, right, to see the meta-analysis and systematic reviews that will really help the students and the novice physiotherapists to have a great insight on it.
Yeah, I've come across one more book Dr. Hegde has written, from Indian writer only, and he has also mentioned what you don't get learned in medical school. So that also I found very interesting, and that is again recently he has mentioned, and that also I felt like, it would be helpful for the students to come across. If they can, bring all these things in their studies during the time pass, they can read all such books. That will be helpful. Okay, thank you so much for your time and the precious, and this was really important topic which we could not learn in our studies and all. Thank you so much, Dr.
Thank you very much, ma'am. And I hope that it have ignited the minds to think critically. So finally, I would say a great thanks for everyone to provide a great opportunity to me. And I recommend to think.
Yeah, thank you. Definitely. That's a good point what you have mentioned over there. Hello. Thank you so much. Now I'd like to invite Dr. Paulson, sir. If you'd like to say a few words. Hello,
sir.
Like
as he mentioned, Mark Jones was my teacher in 2000, University of South Australia. So definitely, clinical reasoning has been there from 1990s in the physiotherapy field, but in medicine, it has been there from 1950s. So that's where, we find a lot of differences in our approaches. So well narrated, Dr. Kaviarasu, who has done his job with the limited time and with limited resources, without much interactive. It's very difficult to have clinical reasoning without that. And well done, IAP, WC, for doing a wonderful job. There are a lot of books, a lot of literature which can be accessed, which I can forward, or I think Dr. Kaviarasu can forward that, which will help the budding therapists and everyone. So the most important thing, what he said, is developing the clinical pattern, which is very important. So writing down, important signs and symptoms from your patient rather than the book, which is important for all the budding therapists. Thank you. Wonderful presentation, Dr. Kaviarasu.
Thank you so much, sir, for your keynotes to putting on this topic. Thank you. Now I'd like to tell this thing, for a vote of thanks, as Dr. Paulson has joined us, for your time and everything. And same time, I would like to thanks to our team and Dr. C.K. Senthil Kumar sir, and IEP secretary, he is Karnataka, and joint secretary, and Dr. Ruchi Varsne, and she's the treasurer IEP, and she's the pioneer of IEP WC. And same time, I'd like to thanks Dr. Ramya ma'am, and she joined zonal head, South zonal head, and she has helped like beyond her limitations, we can say, and we could have never ever come up without her support. And same time, I'd like to thanks Dr. Samuel sir, and he also helped a lot IEPWC to conducting all these programs and everything in all the possible aspects and all. And thanks to our IEPWC team, Dr. Sumita, Dr. Shanti, Dr. Bhavna, Dr. Tripathi, and Dr. Kalai ma'am, and for making this events and everything successful. Thank you, everyone. Thanks to the participants. And same time, I would like to announce for tomorrow's topic. Tomorrow again, we have the webinar at 4 to 5. which is topic is falls in the elderly clinical management and the physical perspective same time, and which will be conducted by the Dr. Anup and Dr. Vinod, and 4 to 5. So I would like to invite you all to join for tomorrow. You can register. Same time there is a link mentioned, and like Dr. Subita and Dr. Shanti, you can contact them for the registration for tomorrow's event. Thank you, everyone. Thank you.
Thank you.